So our lab focuses on identifying natural compounds with therapeutic efficacy towards various diseases. Today, my talk will be focusing on certain diseases related to the muscles and the joint. Okay, so as you all know, in the aging world, a lot of populations are aging, there's an increase in lifespan, but that also makes a lot of people suffer from a variety of chronic diseases. And because of that, people's interest in preventing the onset of diseases as well as taking care of them is a very important question. So because of that, the market for functional foods or nutraceuticals, such as these natural compounds, are also booming. So our lab focuses on finding those type of compounds that can help people to maintain their health. So the first topic I'm going to talk about today is about rheumatoid arthritis. So rheumatoid arthritis is a type of arthritis. There's various types of arthritis, and for rheumatoid arthritis, one of the major characteristics is the inflamed synovium. So synovium is a very thin layer of membrane that's the outer rim of the joint. So here's the bones of the joint, and here's the synovial membrane, which is very, very thin for normal people. But if you have rheumatoid arthritis, this membrane becomes extremely thick. So they proliferate and they acquire a very aggressive phenotype. So they become inflammatory and they start to invade and migrate. And they migrate to the joint, the inner area. So they start to destroy the bones as well as the cartilage, and that causes functional problems as well as pain in the joint of the patients. And the interesting part is that this, not like the other type of arthritis, rheumatoid arthritis is an autoimmune disease. So there isn't an actual cure for it. There are a lot of drugs and that there's a lot of improvement compared to before. However, there isn't a complete cure at this moment. And generally, the number of incidents for rheumatoid arthritis is increasing worldwide, including Korea as well. Normally, women are more prone to getting this disease compared to male patients. And there's various life risk factors, there's just genetic factors and age. But not like other diseases of the arthritis, this can actually happen early in life. So a lot of 20 or 30-year-old patients do exist, not like osteoarthritis. I'll give you a brief introduction of how rheumatoid arthritis happens. So majorly because it's the autoimmune disease, we have abnormal B cells and T cells that form in our body. So these B cells and T cells starts to attack our own cells. And in the case of RA, the B cells and T cells secrete cytokines that's going to transform the synovial cells. So as I said before, in normal healthy people, the synovial cells, or the membrane is very thin, also almost a monolayer. And the synoviocytes over here are generally just secreting lubricants to help the joint function very well. But once they become arthritic, they start to proliferate and make a very thick layer of cells. And the synoviocytes start to change in an epigenetic mode, and they start to secrete a lot of factors that start to break down the environment near the joint, and they'll start to migrate and destroy the cartilage and the bone, causing the destruction of the joint. So up to now, most of the therapies are focused on anti-inflammation, where they're trying to shut down the cytokines that's responsible for these type of responses. However, as you can see from here, the synoviocytes, the fibroblast-like synoviocytes, or we can call FLS, these cells are the major effector cells that actually destroy the joint in our body. Therefore, a lot of people are suggesting that it will be beneficial if we can co-target the activity of the FLS in addition to the arsenals we have in the clinic at the moment. However, for now, we do not have any drugs that can directly target the movement of the FLS cells. So in our study, what we wanted to do was we wanted to focus on if we can find certain molecules that can inhibit the activity of this FLS cells specifically. So we isolated FLS cells from the rheumatoid arthritis patients, and we treated about 315 natural extracts that we can consume. And among the 315 natural extracts, dry ginger came as one of the strongest extracts with the potential inhibitory activity. So this screening was conducted using human synoviocytes from the patients, and we added IL-17, which is an inducer of rheumatoid arthritis. We measured the inflammatory responses. And we wanted to know which component of dry ginger was the most responsible active ingredient. So we compared multiple compounds in dry ginger, and among those, we identified A-shogal as the most responsible and most strongest active component. So we wanted to further dig into this compound. Now, if we actually look at the patients of rheumatoid arthritis, they have different reasons of why they have this disease. And some patients have high levels of IL-17, while the others have high levels of IL-1 beta, and some people can have high levels of TNF-alpha. So there's a difference among patients. And sometimes you can have both or all three of those cytokines highly elevated. So these cytokines can individually act as a triggering factor for arthritis, but they can also be combined and have a synergistic activity of making it even worse. So what we wanted to do was we wanted to see if our compound can inhibit all three pathways, the pathways that are dependent on these cytokines. So we isolated FLS cells from actual patients, and we added a TNF-alpha or IL-1 beta or IL-17, and we measure the responses of what happens. And as you can see from here, TNF-alpha obviously induces inflammatory responses. However, the A-shogal was able to suppress very well, and that was observed in 3 different markers. And also that was similarly absorbed in IL-1 beta as well as IL-17 induced inflammatory responses. So we were able to see that this A-shogal compound can actually inhibit TNF-alpha as well as IL-17 and IL-1 beta induced inflammatory responses. And also, as I said, because these cells migrate, they actually move and start to destroy the nearby environment, we also saw that A-shogal was able to block the migratory phenotype of these cells, so they can actually block the movement of these cells from entering the nearby areas. And then we also analyzed what type of molecular mechanism was behind the activity of this compound. And we analyzed a variety of signaling pathways that is stimulated by TNF-alpha or IL-1 beta and IL-17. Eventually, if you sum it up, we were able to find that A-shogal was able to inhibit the IKK, AKT, as well as the MAP kinase pathway. And we wanted to know the direct molecular target, the protein that A-shogal can actually directly bind to. And through a kinase array, we screened a bunch of kinases, and among that we found that the TAC1 kinase was the strongest potential target of this compound. And we found that A-shogal was able to directly bind and inhibit the activity of this TAC1 kinase. We were also able to analyze the binding mode of this compound into the TAC1 kinase. So we found that A-shogal can actually directly inhibit TAC1, leading to the suppression of various subsequent signaling pathways. And also because in actual patients, the synovium is in a 3D structure. They're very thick. So we wanted to mimic this in actual life. So if we do a 2D culture, it's not an actual situation. So we isolated the cells from the patients, and we made a small, it's like an organoid or a micromass that mimics the actual situation in the patient's joint. So we culture this for about 6 weeks, and we can make it into a thick layer of synovium. We wanted to see if our compound can actually inhibit the inflammation in this kind of context as well. And we used 2 different organoids from 2 different patients, and we analyzed at various time points, and even at this model we could see that the treatment with A-shogal was able to block the inflammatory responses in most of the examined time points. And lastly, we wanted to see if this compound can act in vivo, so we induced arthritis in the rats. And after the rats got a very swollen feet, we injected A-sugar to the rats, and we were able to see that their thickness as well as a lot of their phenotype was reversed. And when you actually have arthritis, the rats have their problem in their working ability, their walking ability, because their joints are damaged. So when they get damaged, their walking ability is disabled, so they can't really walk very well on the beams. But if you administer the A-sugar that actually recovers their ability to walk on the beam. So by measuring this, we were able to show that it can actually enhance their functionality in terms of their joint pathologies. To sum it up, we found that this particular compound was able to directly target TAC1 kinase, which leads to the inhibition of inflammatory and migratory responses on the synovial fibroblasts, which leads to the reduction of rheumatoid arthritis of the animals. So the next topic is about muscle health. So we also study certain compounds for muscle health. And muscle, as you know, is the largest tissue in our body. Compared to any other organ or tissue, the muscle comprises the largest amount of mass in our body. And while it does play the most important role as a structural and movement, but it also has a very important role in the metabolism as well. And the thing is, when people get old, they lose a lot of muscles, which is a natural phenotype of aging. Plus, if you have certain type of diseases, that can actually increase your rate of losing muscles. So these days, maintaining a certain amount of muscle mass is very important for health. And we have certain diseases called cachexia. So cachexia is a sort of a disease where it's characterized by a loss of weight via skeletal muscle and adipose tissue loss. So we lose the muscle and the adipose tissue, and this can be driven by multiple factors. Generally, if you have cancer, that's also can happen. If you have a chronic inflammatory disease, that can also lead to cachexia. So a lot of these factors can drive your, enhance your rate of losing the muscles. And it's known that actually more than 50% of cancer patients actually have cancer cachexia as their primary reason for losing, not just reduced in their quality of life, but actually that could directly cause the loss of their lives. So the market for cancer cachexia is growing very rapidly. However, currently there is no approved drug for cancer cachexia. And because this takes a very long time, so we wanted to see if there is any natural compounds with relatively low toxicity that people can consume for a long period so they can help with their muscle problems. And among various pathways that leads to cancer cachexia, one of the major ones that people acknowledge is the JAK-STAT pathway. So the JAK-STAT pathway is very critical in the muscle in terms of cancer cachexia models. So when you have cancer, for the cancer patients, the tumors actually secrete certain factors, and some of the factors are very highly inflammatory. And people found was that these cytokines can actually directly target the muscle and the adipose tissue, and they activate the JAK-STAT pathway in the muscle. And that leads to the atrophy. They cause shrinkage of the muscle, so they directly inhibit the growth and actually promote the shrinkage and decrease in the muscle size. So targeting JAK-STAT has been recognized as one of the primary targets for cancer therapy, cancer cachexia. So what we did was we screened about 684 natural compounds against JAK kinase, and we wanted to see if there was any natural compound with relatively low toxicity profile that can suppress JAK kinase. And among the 684 compounds, we found this particular molecule, scutelarane, which was the most strongest one. And when we measured the IC50 and the binding affinity, we found that scutelarane was relatively had a low IC50, and more specifically target JAK2 and JAK3 in vitro. So we wanted to further see if this compound can actually have effects on the cells. So when the cancer cells secrete these TNF-alpha and interferon gamma, they causes the shrinkage of the muscles. So what we did was we treated interferon gamma and TNF-alpha to the muscle cells, and then we treated scutelarine to see what it could do. And when you treat these cytokines, you see a very strong induction of the JAK-STAT pathway. But by treating the scutelarine, this was able to block the JAK-STAT pathway in these cells. And more importantly, when the muscle myotubes are treated with the inflammatory cytokines, they actually show a shrinkage. Their mass decreases. However, if you treat them with scutelarine, they were able to recover from the shrinkage. So you can see that the decrease in the mass of the muscles was recovered after scutelarine treatment, and also a lot of markers were also reversed. So next thing we wanted to do, if we wanted to see if actual cancer cell mediated responses can be suppressed by scutelarine. So what we did was we can harvest the media from these type of cancer cells. So this is a colon cancer cell. And we harvest the media from the colon cancer cells, and we can treat this to the muscle cells. And what happens is these myotubes, these are differentiated muscle cells. And these myotubes they get shrink when the medium is treated. However, if you co-treat them with scutelarine, you can see that their level of shrinkage is recovered. So the scutelarine is able to reverse the shrinkage caused by the tumor cells. And next, we conducted two different animal models to see if this can work in vivo. The first one was we pre-treated the mice, so we actually made the mice consume orally a scutelarine for a certain amount of time, and then we injected with the tumor cells. And once the mice has the tumors, and if the tumors grow big enough, they start to cause cancer cachexia. So they cause a shrinkage in the muscle. So and because the muscles are shrinked, not just the size, but their ability to exercise is also reduced in these mice. So if you measure, like for example, if you measure the running distance or running time and ability, these activities, you can see that when you have the tumors, these mice have a very significantly reduced ability to exercise. However, interestingly, if you actually have the mice consume scutelarine, you can see that their muscle exercise ability is actually recovered almost back to normal levels. And in addition to that, when you actually analyze the size of the muscles of these the mice, you can see that when the mice have the cancers, the muscle size is reduced. However, when you actually treat with scutelarine, you can see that the muscle size also can be increased similarly back to control levels. And this is observed in all different type of muscles. And also the diameter of the muscle itself is also increased by scutelarine treatment. Next, we wanted to see if scutelarine can act in a more therapeutic point of view. So in this particular model, we injected the tumors first. So we made the mice get the tumors first, so they have cancer cachexia, and then we started to give them this compound after the muscle has sort of shrinked and when the tumors are big enough. So after the tumors are grown, then we start to give them a scutelarine orally, and we also wanted to see if they can have similar effects. Now, even in this case, you can see the exercise ability is decreased when the mice have tumors. However, if you give them scutelarine, you can increase their exercise ability back to a little bit back to control level. Also, if you analyze their muscle mass after sacrificing them, we found that the mice with the tumors have a reduced amount of muscle mass. However, if you give them scutelarine, their size of the muscles are also recovered back to control levels. And those similar results were also observed in the size of the muscles as well as fat tissue. And after sacrificing the mice, we took the mouse's muscle tissue, and we wanted to see if the actual molecular overall transcriptomic levels has changed on what we were expecting. Now, because, and if you see the overall pattern over here, so the control is in this triangle green over here, and the LLC is the one that has the tumors, which is over here, and the red dots are the one that receive the scutellarin. So as you can see, the overall global transcriptomic pattern, there's a very dramatic shift from the control, between the control and the tumor group. But if you receive scutellarin, even if you have the tumors, you can see that their overall patterns of mRNA is shifted back almost near the control level, which shows that it's a very strong effect at the molecular level as well, which you can see from here. And if you analyze the details, we also found that, as expected, the JAK-STAT pathway was one of the strongest induced pathways in the muscles after getting the tumors. However, if the mice received scutellarin, even with the tumors, they were able to suppress the JAK-STAT pathway very significantly, almost near to control levels. Lastly, we wanted to see if these effects can be recapitulated in human muscles. So as you know, human muscles are not really easy to obtain because normally people don't give out their muscles for no reason. So what we did was we used human-induced pluripotent stem cells, and you can differentiate these human stem cells into actual muscle tubes in culture. So we made these human muscle tubes in vitro, and we treated the interferon gamma and TNF-alpha, which are the primary inducers of muscle atrophy or cancer cachexia. And you can see that the size of the myotubes are reduced on the human muscles. However, when scutellarin is co-treated, it was able to re-increase the size of the muscle mass, as well as the JAK and STAT pathway was also significantly reduced in the human muscles when scutellarin was treated, suggesting that these effects can also be, this compound can also target similar pathways in the human muscle as well. Lastly, we wanted to see what was the detailed molecular mechanism of how scutellarin is affecting this JAK-STAT pathway. So we gathered up several similar derivatives of scutellarin that exist in nature, and they have the backbone is identical, but their difference in hydroxyl groups make them slightly different. And we analyzed their structure-activity relationship, and we found that scutellarin, as well as this compound over here, they're the only ones that had a strong effect. And that allowed us to know which hydroxyl group was responsible for binding to the JAK kinase, and that helped us to analyze the binding mode between the JAK kinase and the compound. To summarize, we found that this natural compound was able to increase the muscle size in mouse muscles, as well as in muscles in the mice after having the tumors, and also in human muscle cells. And this was due to directly targeting the JAK-STAT pathway. So this work, the arthritis work, we collaborated with Dr. Razul's lab at India, and the cells for the human patients were provided by Dr. Lee and Kim from the hospital. And Dr. Zhang and Jin also helped us with the muscle work. Thank you for listening.